Hi everyone, welcome back to Face It with Dr. G. I'm Dr. G. My voice is in Las Vegas, but I'm still gonna show up and talk to you guys because I did miss last week and I'm so apologetic. It's just been wild, but I have no excuses. So the voice isn't keeping me back and I hope it doesn't hurt your ears. And I wanted to talk today about a topic that seems almost too easy to talk about, but actually it's not, and it's needle versus microcannula. Why do I use one or the other? When do I use one or the other? How do I use one or the other? And so I'm just going to go through my very, basic and straightforward approach when I think about which one I want to use. And I think the bottom line is it's truly important to use both. You need to have both of these paintbrushes in your paint box, toolbox, whatever it is, and you need to be able to use them in multiple different ways. So if you feel as though you need to be trained initially on a certain technique, that's fine. I have changed my approach to training new team members and injectors. I get them ready to go with everything right away. I think it's important to get your hands on these different needles, microcannulas, all the different tools, and it takes practice. So here we are. We're going to talk about needle versus microcannula. In the past, historically, I think everyone has been taught to do mid-face rejuvenation with a needle, down on bone, boluses, great, fantastic. You can have a nice result. Pros and cons with the needle for the mid-face. You can have temporary or maybe permanent lumpiness. The product isn't distributed in a linear fashion. It's punctate or bolused down on bone. And now with the use of ultrasound, what we're finding is that that product really isn't just on the bone. That product, it's called retrograde spread and flow through the needle. And that product actually we are finding is ending up in different layers, specifically the superficial musculoaponeurotic system, the SMAS. And that brings me to a different topic, which I've talked about before on this podcast. But when you have product in the SMAS, we're finding that there's other different sequelae that may happen, such as a little bit of migration or change in facial expression and animation. So we want to be aware of what is actually happening. That product is not staying on the bone. At least all of the product is not. So that brings me to when do I use microcannula? And I definitely love to use microcannula, specifically in the mid-face for cheek augmentation. I think it gives a gorgeous result. You can inject product at different layers. And I call this almost a sandwich method or a layering method where I'll inject one product deep and then maybe another product superficially to give that patient a little bit of hydration, a little bit of a different result. You get structural result and you can have a hydrating result. How do we blend those together? So the microcannula will allow you to do that in a really beautiful way. You can get in that superficial or subcutaneous plane very beautifully. I specifically like to inject and go up towards the hairline, so laterally from the anteromedial mid-face area to give a gorgeous wide cheekbone that's not protuberant or too thin, almost like a lumpiness. It gives a beautiful natural result. There are some times where I'll then look at the patient and fine tune. Some patients need a little bit more actual anteromedial mid-face. And at that point I say, do I use a cannula there or do I use a needle? And I use both. Actually, today I had a patient and I used my cannula method and then went back in and did a couple little boluses just to give a little bit more definition in a place that I didn't need to use a microcannula. And again, this is personal preference and I change my techniques all the time. And I learn a lot actually from my more newer injectors who think in a different way, which is really beautiful. So we go back and forth and think about different techniques and strategies. But my go-to is microcannula. I love it. And then sometimes a little bit of needle on bone. There are some places, well, let me say one other thing about mid-face and ultrasound and microcannula. So it's much easier to visualize a microcannula on the ultrasound in the horizontal plane. You can get some reverberation artifact, but it is so much easier to see that than it is to see a needle. So that's another way to double check the plane you're in and placement of the product. So I love that. And actually at FACEit Live in December, we're doing this conference in Cambridge. We're going to go through identification of microcannulas on the ultrasound when we have them inside real live patients' faces and in cadavers, and you get hands-on experience. You'll have all the faculty members helping you, so that's awesome. So all these things can happen like this year, right? You can make it happen this year. So going back to a needle. So a needle for me, I think of as it can be more precise. I think you can be extremely precise with a microcannula as well. But if you want a single bolus, a needle can be the best choice. Another reason why I tend to choose a needle over a cannula, and this is only my own opinion, is when we do biostimulation, and we have biostimulators like Sculptra and Radius, the goal of these treatments is to create collagen, right? That's why we're doing this. And after several treatments, you have made your collagen, and it's typically type 1 collagen. It also can be type 3 collagen. We're now finding Sculptra actually upregulates genes that create elastin. So you have a lot going on in your dermis, and that can create more difficulty when you're using a microcannula because the microcannula is blunt-ended. So I found, and I've done a bunch of internal studies and tests on my patients. I'll use a needle on one side for Sculptra, and specifically in the lower face is what I'll do. And then I'll use a microcannula on the opposite side, and I ask them which one was more painful. And many patients will say the microcannula was more painful. And I found that it was specifically in patients that it was not their first Sculptra treatment, but it was one of their multiple 2, 3, 4th treatment. So for Sculptra, in the lower face preauricular area, I tend to use a 25 gauge, 1.5 inch needle, which is actually what Sculptra is FDA approved for. And I find that it's easier to stay in the right plane and it's more comfortable. So I'd actually love to hear all of your thoughts, what you think. But this is my experience, and I love the precision of it, and I love how patients are more comfortable with it. The other place that I inject with needle is the temple, and I love to use Sculptra in the temples. It is a beautiful treatment. It takes time, it's gradual, it can change the entire affect and phenotype, but I tend to use needle there, and when I do that, I'll use it deep on bone in the upper part of the lower temple. It's a gorgeous result. I also use microcannula in the temple, and this is specifically usually in layer 4. It's one of those treatments that you need to do a cadaver lab. You need to feel it, you need to see it, you need to understand how to access this layer. Ultrasound helps, and there you can lay Sculptra or a hyaluronic acid gel. So temple can be either or. I prefer needle. I use Sculptra deep in the temples more often than not, and that's my go-to. For piriform, the piriform sinus, I also use needle. I will not inject the temples or the piriform sinus without a previous ultrasound, and that's because we're finding the vasculature, the angular artery in the piriform area is not on the bone 2 to 3% of the time. It's on the bone about 25 to 30% of the time, and I'm quoting an article that's coming out soon by Dr. Weiner and other colleagues, but we're finding that this is more common than not, and it's also not the same on both sides, so you'll have maybe a difference in vascularity. So that's first, ultrasound first, and then I'll use a needle and I will inject Sculptra deep, or I'll inject a hyaluronic acid gel deep, and that's for precision and placement of the product in the piriform. Can you use a cannula? Absolutely. It's just what I do. Another reason I use cannula is for platelet-rich fibrin injections underneath the eye and in the nasolabial folds. We love that. And tear troughs. So tear troughs, I'll use a combination of needle and cannula. So maybe you're getting the gist here. You need to use both of them and understand both of them, but under the eyes, I'll do a deep injection to give a little bit of support on the bony rim, and then a more superficial injection with a microcannula. So now it brings me to what size of needle or microcannula. So for me, in my practice, my go-to microcannula size is a 23 gauge, 1.5 to 2 inch microcannula. 23 gauge is the perfect gauge. We have found that the smaller gauges like 27s and even potentially 25 gauges can make their way into a blood vessel, and we obviously don't want that. So we use 23 gauges. For the neck and some other areas, we'll use a 22 gauge, 2 inch microcannula. It's more rigid, a little harder to learn to use, but once you know how to use it, it's pretty straightforward and great. So 23 is my favorite. And for needles, obviously, if you're doing a deep injection, you're using a higher G prime product. So you're using something like a 27 gauge 1/2 inch needle. So that's that when it comes to an overall view. Of course, I didn't touch on every single treatment and every single anatomic area of the face and neck that I do treat. Obviously, we use needles when we inject neurotoxins, and the biggest thing is microcannulas when you're using hyaluronic acid fillers and biostimulators. So I hope that helps. I hope it stimulates questions for you. I'm encouraging you to reach out, ask me questions, and like, subscribe, follow. I'll see you guys next time with my full voice.